Mm. I think that's a very valid point. Obviously, if you have data, it's much easier to act and also understand where to attack the problem. So definitely agree on that. Maybe we can move on to James Kaitani, working with community of Kenyans with different kinds of disabilities, and also looking at how does how healthcare providers kind of serve that market and so on. How would you describe the healthcare market as part of, from your members' perspective? Do you feel like the kind of care and healthcare that is being provided towards people with disabilities to the level where it's acceptable, or do you feel like it's a lot needed to be done? What's your take on that?
Yeah, thank you so much. So I would actually say I will just start by your last statement, that there's a lot that still requires to be done, and maybe I will pick from where James stopped in terms of what is the pattern right now, especially around the issue of communicable diseases. That for sure is an issue. We know we're in a country where, for example, we have growing situations of communicable disease, non-communicable diseases. So you have people who have issues with diabetes and they get amputations, and because of that, definitely what they end into is having the need for rehabilitation. And that's where we come in. So as institutions like APDK and people within that space, our challenge is how do we then meet those needs, so that then individuals who have found themselves in those situations that can still be able to have quality rehabilitation and also live a good quality of life. But again, back to the basics again in terms of how is our health system able to, for example, to early detection of disabilities. We know, for example, that we have a very we now really kind of promoting the use of pregnant mothers, where you have the use of IVAs, folic acid and all that, which is really good. But if you look at in terms of the penetration, down to the communities where you have people who are still unreached, you still find that we still have large populations of disabilities that are out there, and yet we are not able to detect that early enough. Because the earlier we are able to detect that, then we can be able to put our interventions in place. So for us, we as an institution, as also as an individual, my background was on rehabilitation and physical medicine. So when you look at it from that continuum of medicine, you look at it from curative, rehabilitative, all that, then we are at the very end of looking at how do we then strengthen systems that are able to identify, for example, when we have disabilities, being able to, work through the referral pathways that will allow this child to be identified, early intervention in terms of whether you need surgical intervention in place, or if there's any other kind of support that is required. Then that becomes the issue, that a gap that we really need to address over time. We know that we, as a country, the WHO statistics points out about 15% of every population as a disability. And for that reason, when you even look in terms of our data and statistics, we just did our census in 2019, and it stands at 2.2%. So that tells you there's still a lot of huge demographics that are not being captured. And for that reason, those are areas that we need to improve in terms of surveillance. How do we able to identify, persons who have disabilities early enough, children, and from that infant stage, how are we building communities and families to be able to find, ways of identifying early enough? Because until we do that, then we've not been able to really kind of scale down or cascade down the level of community health education, where people that can be able to, communities, families can then be able to participate in that early identification and intervention. Yeah, but of course, that's really, there's quite a lot that can be done in terms of healthcare. When you come down now to even issues of rehabilitation equipment, we know, for example, if you have a disability, you need an assistive device. So whether that is a wheelchair, whether that is a prosthesis, or whether that's a crutch, or any other form of assistive device or technology, then we find that within the health sector, we are underfunded. Rehabilitation programs across this country are not adequately funded, and so you find somebody acquires a disability, and then the rehabilitation journey becomes so, so complicated, so complex, and you are not able to really become the person that you can be able to achieve your full potential, even though you have a disability, because what you require is a support, a rehabilitation program that makes sure that whether you are in the far-flung areas, you can still be able to be accessed and served. That is what is still lacking today. And it's something that we need to work, and as actors in different spaces, it's something that we certainly need to put a lot of our energy and resources as well.
I agree 100%, and thank you so much for sharing that, James Katani. My next question is to Benjamin Wachira, and somebody that works within emergency services and also is an assistant professor. I assume you have a very good perspective about the general healthcare industry, and not only maybe emergency services, but what's your broad take on the status of the healthcare industry in Africa as of today?
Thanks, Jonas. I think the main thing, our healthcare systems across many African countries are really underdeveloped, and challenges within this is, I always say, from a Kenyan perspective, what I can say is, for many years, healthcare in Kenya, and I guess also in many African countries, has been potentially donor funded. And over time, the governments have relegated their duty to provide healthcare to donors, and focused on other areas of, I guess, development and less on the healthcare systems. And what we see a lot of right now is lack of ownership from the governments around ownership of healthcare, and it's seen to be someone else's responsibility. And I guess COVID-19, for example, brought in, refocused a lot of the governments to look at healthcare. But even in our settings, and again, I speak for Kenyan perspective, we again looked to the donors to support our own COVID-19 response. So again, the government not necessarily looking at it as its responsibility, but something that someone else needs to come and sort out. And there was the flourish of donations that came through from the West, and different countries have had different experiences with these donations. And so, and as we pretty much go back to status quo now that the donations are over, and COVID-19 seems to be changing, well, let's go back to our problems and other things. So still no real focus on healthcare. And government, I think one of the things that just has happened, I know in Kenya what has happened, this has led to the mushrooming of private healthcare systems, which in some extent have provide really good service and affordable services, providing the different ranges of services. But at the end of the day, majority of people who cannot access healthcare is because they cannot A, afford to go into private systems, and B, the existing public healthcare systems have been neglected until someone comes and pumps in some donations to support. So I think overall, most of our healthcare systems are really not well developed, and a lot of this is potentially due to the government's not necessarily looking at healthcare as their responsibility rather than something someone else would have come and help with.
I think that's a very valid point, and maybe something that at least from my perspective hasn't been discussed so much. The whole aspect around the dependency that is being created, who has accountability, who is responsible, and also understanding, both the short-term and the long-term plan. I assume, because healthcare is a basic service that everybody, that's a human right. And should be accessible for everybody. So the aspect around what should be government's role, what should be the accountability, I think is very important to bring on top. I think you all brought up very interesting perspective, but when we look at solutions and what is needed to be done, I mean, I can already now look at some, clearer point, but what kind of opportunities do you see as part of improving the healthcare industry and sector? Maybe we could start with James Guerrero. And here, opportunities can also be within system thinking, could be within government, could also be, driving innovation, digitalization. So it's a fairly broad discussion here. So you can kind of pick the areas where you think is, where you see biggest opportunity, basically. Thank you. Yeah,
Yeah,
James.
sure. Thank you, Jonas. So I think it's interesting. When I started working in the early 2000s, the opportunity that arose within the health system was HIV. The advent of HIV and the support that came towards supporting treatment for HIV, especially in the public sector, changed the health system in many ways. Some of the things that M&D became much stronger in the HIV era, and it was primarily initially for HIV and then spread across the health system. Logistic management information systems for ensuring that commodities, because HIV was suddenly a very exacting master. People had to have medication, they had to take it at a certain time of the day, and they had to have a refill available when next they had finished the packet that they had. And so being so unforgiving, it helped the health system to step up to the challenges that arose at the time. And indeed, a lot of the stuff that HIV, even on the medical technology side, supported the sequencing of genes for determination of HIV ARV drug resistance. And so that is capacity that you find can be used for other things. In fact, there's exploration now of how that capacity could be used for tracking mutations of the coronavirus across the continent. And so I think one of the opportunities, strangely, is the COVID. The COVID response itself offers opportunities to strengthen the health system in many ways. One of the key concerns around the continent now is service continuity. Like, are the other services, aside from provision of testing, tracking, tracing, and treatment for COVID, are the other services working? And so if we then use the opportunities that the COVID response affords, in many cases you find that there'll be a strengthened availability of ICU services, a strengthened availability of certain kinds of emergency services, and also medical oxygen systems are being forced to step up to make oxygen more available. And you see, oxygen is life-saving beyond COVID, yeah? But you see, we were never alive to this need in many places sufficiently until COVID came, and really it was the difference between life and death. And now as we push oxygen into the farthest reaches of the various countries, then oxygen will save the lives of mothers, will save the lives of babies, like I was saying, are important priorities at the beginning. The other opportunity that I see is the digitization and the rapidly changing pricing of computer hardware, phones, smartphones, the increase in connectivity, the increased availability of electricity, and also technologies such as solar technologies. And these provide opportunities around equity, because one of the biggest challenges on the continent, like I was saying before, there's such variation in outcomes, even within countries. And a lot of that has to do with areas in which underinvestment has been made in health systems, but also in general infrastructure and other things like livelihoods that are social determinants of health. And so as these technologies become more democratized across countries, then you find the new opportunities, the opportunities to collect health data, the opportunity to react to situations faster, health emergencies. There are opportunities to use even drone technologies for mapping situations in emergencies. And so there are substantial opportunities around information technology, around some of innovations such as drone technologies, and on just the availability of hardware that can be used, even because there are countries now in which every community health worker has a smartphone in their hand. And that is a smartphone that they can use to track, to do civil registration and vital statistics, to register babies when those babies are born, to track the lives of those babies, the immunization history, to even do send simple data into the health system, such as mid-upper arm circumferences for babies who may be malnourished. And so that stuff can be done about these things. And so uh, as much as it's been blamed for many things, this deluge of information, I think that it's a huge opportunity that we can use to strengthen health systems. Then I think there's also an awakening around certain specific areas of the health system, especially a greater awareness around non-communicable diseases. So non-communicable diseases, diabetes, hypertension, and certain respiratory conditions such as asthma, but also mental health. There's a general awakening in mental health. There has been a stronger involvement in looking at, since the development of the MH gap document that details the treatment gaps around mental health. And so you can see these kinds of opportunities as the world is changing, and as the global health system becomes more seized of certain particular things, and as we run into these kinds of problems like these pandemics, there is always a crisis, an opportunity, and a reawakening that we can make use of to strengthen our health systems to deliver better, and with a focus on the outcomes that we've first sort of prefaced this discussion with. You're muted, Jonas. You're on mute.
Sorry for that. Thank you for that, James. What I was saying was, I think that's a very interesting perspective to have, trying to look at crisis as opportunities and areas where, where something positive can actually come out of it. Obviously, depending on how you address it or not. But I think I would like to jump to you, Benjamin, specifically discussing these opportunities that maybe some of them that James mentioned that you agree with, or maybe some others that he didn't mention as part of opportunity areas that you see in the healthcare industry.
Thanks, Jonas. I think one of the things that we definitely need to embrace, and especially, I guess, within the African context, is the use of technology in healthcare. I think this is an issue that has pretty much not really been tackled. I mean, if you take, again, an example, pretty much almost everyone has a smartphone. We are very good to internet creativity, internet connectivity that's very affordable, but majority of the healthcare facilities are still working on rudimentary paper, pen, and nothing that has any form of technology. Devices in use are old devices. And so the whole country seems to have moved advanced technologically, but the healthcare industry has remained in its old traditional way. We still have patients, for example, who come to hospital with a piece of paper for their medical records. And the problem with all this is, of course, then we do not have reliable data that can be used to make improvements in the healthcare system. And majority of suggested improvements in the healthcare system are based on people's suggestion or small research done here and there that may not necessarily be representative of the whole healthcare system. So I think one of the things that potentially needs to happen is for the healthcare system to embrace technology to a point where we actually are getting meaningful data back from the system to be able to even quantify the disease burden in a more accurate manner rather than guesstimates and extrapolations from different numbers. So I think that's one of the things that definitely needs to be looked into as a potential um, thing that can help us move forward. So it's not necessarily that the technology does not exist, it's just that it's not being embraced within the healthcare system. And this, of course, then becomes a whole new challenge in terms of we cannot account properly for the resources that patients would need. And people cannot budget appropriately to make sure resources are available, because if you majority of the places when we're doing some of our research to just ask how many patients do you see in the emergency department annually, and everyone gives you some rough estimate of some sort. So when you go back into budgeting to see how do you budget for the emergency, it's actually very hard to budget. So I think that's one of the things that needs to be looked into, but also one of the things that in terms of how we look at healthcare. And for many years in our setting, healthcare has always been addressed by diseases. So this time we're dealing with malaria, next time we're dealing with HIV, the other time we're dealing with TB, and never really looking at the whole system as one, where patients with whichever condition comes in. And we have potentially very successful programs that are managing silo conditions. But since there is no connectivity, there's a lot of duplication. Again, because there's no connectivity, even using technology. So you will find patients getting a lot of resources being duplicated and wasted, because I would not know what's happening in the HIV sector yet I'm dealing with a patient with malaria and HIV, because that is just not connected. So I think one of the potential things that would need to happen is looking at using of technology to connect all these programs to get more of a horizontal approach to the healthcare system, and use this to now look at how do we build their system, not build individual programs. Because at the end of the day, the system is supposed to cater for all patients, regardless of what medical condition they present with. So, and I think I mean, we just need to start from the basics of use of technology, and mainly start gathering data, and then importantly to use that data to now start looking at areas we can address to make the system more effective and more efficient. And I think in the long run, this will also help in terms of the cost effectiveness of the healthcare system, and making sure that it's we're able to budget appropriately, because potentially there's a lot of wastage in the healthcare system because no one actually knows what's happening because the data doesn't exist.
Thank you,
You're muted.
Benjamin. Yeah, sorry, I keep making that mistake. Um, yes, thank you so much for that, Benjamin. I think that's, yeah, same again, very relevant, specifically the aspect around not doing so many programs, but more you focus on building a system, right? And this stopping this silo thinking that you can't build a healthcare system by building everything in silos. It needs to be integrated. You need to have a holistic overview perspective, right? Am I understanding you correctly? Do you all agree with this?
Yes.
Thank you. I think my next question is for you, James Ketani, specific looking also at services within assistive technology, but also services outside. Where do you see a lot of the opportunities for people with different kind of disabilities or without disabilities?
Yeah, thank you very much. So like I think like everyone else has alluded to, I think technology is something that we can it still presents as one of the greatest opportunities, and what I'm going to narrow down to, how do we use technology to support provision of quality rehabilitation services for persons with disabilities. And I would say this because we know, for example, technology such as 3D printing. So 3D printing allows you to be able to get, for example, a very accurate impression of if you're making a prosthesis. So you are able to get the 100% impression of the stamp of this client, and then be able to now make design your product to meet exactly the need of this person. This was not something that was there in many years back. Something to do with how do I get someone who is in Mandera today, and technology can still provide a solution to that. How do I get somebody who needs a wheelchair, for example, and is based in Mandera, instead of having to come all the way to Nairobi for measurements and things like that? So technology provides us the opportunity to be able to, factor this into the design of things, so that at the end of the day, then you are able to get this information, get the details that is required for you to design a product, even without having this individual come all the way to Nairobi, because we know that across these far-flung counties, these services are completely non-existent. And so technology really plays a critical role in filling into that. Again, we also know, for example, issues to do with taxation is also another opportunity. We know that as a country, the government taxes its citizens so that they can provide services. And so in doing so, we also want to see how can we implement taxation programs that kind of also allows innovation within the rehabilitation sector. The other day, you saw someone who was able to design a wheelchair that was powered. And that is really something. These are Kenyan. This is something that was designed here in this country. And therefore, the potential to be able to use taxation as an incentive then allows for innovation, so that people can come up with some of those innovations, and then they can be able to roll out, from innovative stage, from the design stage through the development, and then full, scale up in the market. So those are very important things that if taxation was really used effectively, then we can still be able to grow innovations within locally and still meet the needs of the users within this country. Because one of the challenges that we have, and I'm saying this because I've been in this sector long enough, and I'm a rehabilitation personnel, is that most of the time, whereas we look at maybe outside solutions, most of the time when they get here, they are not tailored to meet the needs of the people. For example, you get a wheelchair that is designed somewhere in China, and you use here 2-3 days, and there's no problem really. I'm not saying that Chinese products or whatever it is, but sometimes they are not able to really withstand some of the terrain. Like, for example, if you are living in some of these hilly areas or areas where they're very sandy. So those are the things that we're saying. Local innovation can really be able to, spur that kind of really ensuring this quality service that is reaching to this particular group of people. Something we've always known. We know, for example, the government always has something called syntax. So, that is alcohol, tobacco. And they do this every year. But why can't we, is there a mechanism where, for example, we can channel that resource, part of those resources, because we know alcohol causes most of the accidents, and the people who get, become disabled because maybe they have had alcohol, and because of that have accident, drunk driving, people who've used tobacco, and therefore they have had to be amputated, and now they need a prosthesis. Can't we use some of these resources to build a modern rehabilitation center where it is a one-stop shop? Everyone can go there, from optical, needs all the way across the continuum of rehabilitation service. Then that way we can be able to give our citizens a quality service. And we're not looking even in terms of the people who just had accidents or people who have had amputations, because naturally we, with all these advances, we will live longer. And I think my colleagues will tell you that. And so for that, naturally we'll always have the need for, assistive devices and technologies along the way. So that's something that, for me, I think taxation can play a very critical role. Secondly, the other opportunity we have is also from the global initiatives that are happening. We have something called CLASP, for example, which is funded by USAID. And CLASP is a consolidating logistic for assistive services and products. So this is to say, we want to make sure that anywhere around the world, all the assistive devices that are critical and are required, name them, from whether they are optical, they are wheelchairs, or all that, we require, or hearing aids, we require to have a very strong supply chain. How do we make sure that those countries that require are able to find them in time and of good quality? So that initiative is happening. I think this is almost like the last 5 years that has been the discussion that is happening within the assistive technology, just to say, how do we make sure that we consolidate and strengthen, provision of this quality, equipment in these countries. So having institutions like WHO and USAID coming in to be able to fill into that gap is really, for me, very good in terms of making sure that we address that quality gap over time. And I think the other thing also in terms of we can be able to improve our data collection, because and I think that's a point that Mr. Wairero just talked about in terms of how do we collect data, because then when we have accurate data, then it helps us to inform our policy planning. So using technology, or using ways like mobile technology, then allows us to be able to really gather information very quickly and rapidly, and then we can be able to design appropriately. So otherwise, really, in terms of that, there's still a lot that requires in terms of our policy implementation. We have a very good policy landscape in terms of the things that we want to do. For example, we have the UN Convention on the Rights of Persons with Disabilities, and talks across different number of things that are required to really for countries to be able to meet the needs of persons with disabilities. But when you come into some of those aspects around implementation, that's where we have a challenge. And so I would say those are really things that we can be able to improve and see those as opportunities. And one greater thing that I think I wouldn't miss to mention is the issue about improving our accessibility of our environment, our built environment. How do we enhance accessibility for people who are using these products, assistive devices, so that if I'm coming to your to your office, then if I'm a wheelchair user, I can find an environment that is allowing and facilitates me to get there. So those are the things that, and we have the universal design principles that we design products, our spaces in such a way that it's accessible to everyone, irrespective of whether they are women, old, person with disabilities, children, all that across the board. Yeah.
Thank you so much for that, James. I think that was a very elaborative explanation around, some of the key areas here. I have two questions to you all before we wrap up, but I would like a quick answer, if possible. Maybe I can start with you, Benjamin. One area that was discussed as part of opportunity is getting more local solutions within healthcare and digitalization. What could be done to stimulate more solutions coming through?
I think one of the things that we've potentially not really explored fully is development of solutions by local tech hubs. Okay, so local innovators taking some time first to understand the healthcare system, then going back and looking at what solutions can be made to solve some of the problems. Because I think one of the things, if you look at, for example, Safaricom was an innovation that very much was developed by local technology experts, I guess. And similarly to a lot of other technological solutions that have been provided by very young innovators within the continent, within the country also. And so while tech is very much currently being used for financial solutions, of course, that's where the money is, very little innovation is going to looking at use of tech in the healthcare aspect. And what I've seen mainly right now is people trying to replicate a lot of the telemedicine softwares out there. But beyond telemedicine and a lot of the innovations are targeting a user trying to see a doctor via the phone. But I think there's so many gaps in the healthcare area that could be addressed by use of technology, but we first would need the innovators to get on the ground and understand how the healthcare system and the challenges of the healthcare system, and then go back and try and develop solutions, because our systems have some peculiarities, and it's not always very easy to cut and paste systems. And when we've tried that before, they've not really functioned as they should be functioning, or have they functioned elsewhere. So local innovators understanding local problems will lead us to coming up with local solutions that are tailor-made to our settings.
Thank you so much for that. Really appreciate it. I'm hearing from my colleague here that we have to wrap up because we need to move to the next session starting shortly. But maybe we finalize before we finalize. We get some final thoughts around from you, James Wairero, around what do you think could be done to support innovators. I would really appreciate if you could. And then the next also for you, James Kefani, on the same.
Okay, I think As Dr. Shira said, it really is to support innovators. We have to have these innovation hubs, even make a spaces for some of the, for instance, innovations on assistive devices, as James was talking about earlier. But then the other things that I think would increase equity around innovation to extend the ability to innovate beyond Nairobi and the urban areas would be efforts around electricity, potentially using renewable energy, and then or connectivity. And I was very sad the other day to see the balloon technology that Telkom Kenya was working on, I think, with one of the global tech companies, that they were pulling out that it hadn't worked out. But there's just internet connectivity, electricity, and places where innovation can be incubated. You on mute, Jonas.
I need to stop doing that. God. Yeah, so thank you for that, James Barrero. And James Kitani, on the same question, how do you get more innovation coming through from the, for the assistive technology sector? And please here also, if you could limit it to 30 seconds.
Yeah, I think I won't say anything different from what everyone has said. I fully agree that we need to increase our, our investment in having innovation labs, that are, homegrown and that are led by people, local, solutions to local problems. Even as we look to how do we complement them within what we can be able to look, to the outer world and also, integrate that into what we are doing, because then otherwise, ultimately, that's the only way and sustainable way we can be able to ensure that we bridge the equity gap. Because as long as we still have many of these people in the population that are underserved, then we really have to figure out what a local solution to those. And the solutions are there. The only thing is, I think we've not been very diligent in terms of the investment into those areas, whether that is in terms of financial and resourcing, or issues to even the political will to be able to do so. We have, for example, even the devolved systems are a very good thing. I mean, but we have not really strengthened those structures enough to make sure that they are, efficient enough to deliver those services. Yeah.
Mm. Thank you so much for that, James.
Get 30 seconds.
Yes. Yeah.
Yeah. And another thing I think is between innovation and a business is a lengthy path, but also nobody. So just incubation, business training, and support for production, like from prototype to market, is a path that there's very little support for innovators.
We all agree on that?
Yeah, sure.
Yeah, perfect. Then I think we just finished the session there. I really, really appreciate your input, your thoughts, your experience, and sharing this with us. So thank you again, James Barrero, Benjamin Wachira, and James Keitani. And everybody that's been watching this live on Facebook, YouTube Live, thank you so much for participating on this. Our mission at TAXPAYER Impact and ChangeLab is to follow up on specific areas around solutions, and to make sure that those are the areas that are prioritized as part of funding allocation. So thank you so much for sharing your thoughts and voices. Have a blessed day.
Thank you, Jonas.
Thank you. Cheers.
Cheers.